Thank you, Premier. Today's number is not a great number. We know that. It shows us why we need to continue our very substantial efforts to slow the spread of the virus, to put a cap on the numbers that we might get to until enough of us are vaccinated. But 120 is still far less cases than we would have seen otherwise if we hadn't had the restrictions that we've had in place and continue to have in place. It shows that applying the pressure avoids cases today. That is avoiding dozens of cases next week, hundreds of cases next month, thousands of cases. As the Premier said, there was some modelling done by Burnet that suggests that with the restrictions that we put in place since this most recent outbreak, we have avoided around 6,000 additional cases. But it's not just those historically averted cases, it's the 1,700 cases that would have been added today in that modelling. It's the more than 2,000 cases that would have been added tomorrow. Those cases increase by about a third every single day, more than 3,000 cases per day by the end of the week if we had not applied these restrictions. That is a very substantial caseload avoided for people's avoidable illness, hospitalisation, ICU, and indeed deaths. And it's tragic that we've had 2 deaths, our first deaths so far this year. We can avoid more deaths. I think the risk will continue as cases increase, obviously, but we have to be focused on just what we can avoid here by doing the right thing. These restrictions absolutely do work. And all the hard work put in by every Victorian over the last few weeks has protected our health system. We've got far fewer cases in hospital by virtue of all of that fantastic work. But to ensure we stay protected, we do have to have these restrictions in place until that first dose reaches 70% of the eligible population. That is about 3 weeks away. It could be faster with those 70,000 additional AstraZeneca appointments that could be filled. It could be faster with people reaching out to their GPs and the state hubs for any additional Pfizer appointments that come up. We can get there faster. But until then, the 5 reasons to leave home still apply, and they are more important than ever. It is shopping for essential food and essential supplies, authorised work only, and study, care and caregiving, exercise, and of course, getting vaccinated. Wearing a mask remains a critically important intervention. Wearing it correctly all the time is really important. We'll continue to assess the day-to-day epidemiology and as the Premier said, in regional Victoria, it is on the right track. It is looking much more positive, and we'll make a decision in the coming week on exactly what we can do in regional Victoria. 7 of today's cases were in regional Victoria, including 5 in Shepparton, which goes to show that regional Victoria will remain at risk. But the 5 cases in Shepparton were all in quarantine for their infectious period. So these are small but positive signs. Absolutely, it's tough, and 3 weeks seems like an eternity. That light at the end of the tunnel is too dim and the tunnel is too long, but it is a light at the end of the tunnel. It is the genuine pathway out of here that means that we can take those small steps forward bit by bit and not have to take backward steps again. But it is such hard work for parents, for kids, for whole families, and for single people. For all of us who miss that human contact, for people we haven't seen in weeks and weeks and weeks. I do want to recognise the sacrifices and the wonderful work that so many millions of Victorians have done to get us to this point, to allow us to be positioned that we can protect so many Victorians and protect our health system at the same time. It's taken a couple of weeks for our case numbers to go from 50 to 100, so that increase is slower, much slower than it could have been otherwise, but it is an increase, and that's why my advice has changed. It's not to say that the efforts aren't as substantial as they've always been. It's a recognition of the reality of Delta and of the fact that despite all of these extraordinary efforts between contact tracing and between millions of Victorians following the rules, we are still seeing a slow and steady increase. So we have to move as fast as we can to get the highest possible vaccination coverage, which will change how transmission occurs and will see us plateauing with our case numbers. But we want to do it at a point where our health system is not overwhelmed, where we don't have dozens and dozens of people dying in Victoria. But when we get to 70% of eligible Victorians getting that first dose, as the Premier said, we can look at expanding that 5K to a 10K radius from home for the purpose of exercise and shopping. In-home care, like babysitters, can be further expanded to families with primary school aged children if one parent is an authorised worker, and exercise for that additional hour, outdoor personal training, communal gym equipment, skate parks, private house inspections, and the increase in our construction workforce. Again, not dramatic changes, but a step towards that more normal life that we are seeking to achieve. And it can make us feel a little bit closer to normal as we move by increments. But it is about 3 weeks away. We need to get there as fast as we can. We'll make those further assessments as we progress. It may follow the trajectory that we expect, but we could equally see better or more challenging conditions. So we just need to watch each and every day and make those assessments. We know that Victorians want to get vaccinated. We know that they understand that it's not just protection, it is protection from lockdowns, it is the move to the more normal life that we're seeking. It'll help kids get to exams as we go through this Year 12 vaccination blitz for students and teachers. If you're yet to be vaccinated, please book in. We know that AstraZeneca is a great vaccine. Of the almost million double-dosed Victorians who have had that AstraZeneca vaccine, none of them are in ICU now, none of them. So it provides really substantial protection. You have to keep that in mind when you're maybe wavering on waiting for Pfizer that might be weeks away for you. We've got a plan to ease restrictions, but we do need to bend the curve. We need to get to lower case numbers than we might otherwise get to. So please follow those rules. They are still the bedrock. They are still going to be doing the hard work of keeping numbers in check. If you do need support, it is available, financial support in particular. If you have symptoms, please get tested. And if you don't, and you've yet to receive your first or second dose of vaccine, please make that booking and get vaccinated. Thank you.